Okay, good evening, everybody. It's a couple of minutes past 7, so we will get started. We're just waiting for the last kind of few people to join the meeting and join the webinar. So thanks for your patience. Just to quickly to introduce myself, my name is Mark Williams. I work here at Medical Projects. And this is our first webinar of 2021, which is great. For those of you who haven't been on one of our webinars before, we started doing these back in April last year as a way to just kind of make sure that medical school applicants had all the information that they needed as like a completely free resource. And we did that as a result of COVID, and we're in 2021 and we're still doing that, which is you know, COVID's still hanging around, so make the most of all these kind of free resources that are out there. And thank you for joining us this evening. So just to quickly run through what we're going to be covering today. So January, or kind of December and January, bit of February as well, bit of March tends to be really interview season for medical schools and for students. So what we're going to do is kind of talk about medical school interviews, try and answer as many of your questions as we can possibly fit in. And yeah, just give you a kind of a real insight into what they're actually like. And we've got an amazing student who's going to come and talk to you about her experiences as well, both with panel and MMIs. So if you've got questions about either, like, this is a great opportunity to talk about that with Layo. So just a bit of kind of housekeeping things. We will send out the slides and the recordings within the next couple of days. So don't sit there kind of like furiously taking notes. Don't worry, we will send those out. We will be using the Q&A section at the end as well. So like I said, we will try and answer as many questions as we possibly can, but when we've got 600 students on the webinar, there's going to be a lot of questions. So we'll try and answer as many as we possibly can in that time. If we can't get through them all in that time, then we'll either try and maybe do another webinar if it's super popular. We will be using the upvote system as well, which is a really good thing on the Q&A. It just allows us to see what are the most popular questions that you have. There's like a little thumbs up button. So if someone's asked a question that you would like answering as well, you can just hit the thumbs up button. It sends it to the top, so we know that a lot of people, you know, want to ask that question. We'll be using the polls and the chat function as well, just to try and keep it interactive. So we'll be using those throughout. If you don't know where they are, it should pop up on your screen. If not, if you kind of float your mouse down towards the bottom, there should be like a polls function there as well when we kind of use those. Okay. Right. Just to kind of kick 2021 off, let's see who's joined one of these before and who hasn't. So first poll, I'm just going to launch that now, and I'll give you maybe kind of 10 or 15 seconds to answer that. Just helps us work out who's watching who's kind of tuning into the webinars as well, just so we know where to pitch things. So nearly 60%, this is your first webinar, so welcome to you. And then obviously nearly 40% have tuned into one of these before, which is amazing. It's great to have you back. I'm glad that you found the last one useful and you're tuning in for another one. So it's great. It's great that you're back. So I'm just going to end that. I can even share the results as well. It's all anonymous, but that's just kind of a nice overview, so you know who's watching as well. Okay, this is the perfect time to introduce Layo. Hi, how you doing, Layo?
Hi, everyone. I'm good, thank you. Nice to be here today to host this webinar with you.
Yeah, it's great to have you. So you're a medical student at Newcastle, aren't you?
Yes, I'm a Newcastle medical student in my 5th year. So yes, going great. Nearly done.
Yeah, and you've worked with us on lots of things in the past as well, and you've actually done some of the MMIs that we do with students as well. So you've been through both panel, MMI, and you've been an interviewer as well for us. So you've kind of got all the bases covered. So you're like the perfect person to speak to and ask questions of today, aren't you?
Yes, I've done loads of interview practice with students, and I've also done it through the university as well. So I've seen a university perspective of it as well. So that's all even better.
Okay, well, I'll hand over to you at this point because I know you've got some slides as well. So I'll stop sharing my screen and then you should be able to bring up yours.
Yes, I'm just about to share my screen. So, thank you everyone for having me today. So I'm Layo, or Layo, whatever you like to call me, and I'll be talking about what is medical school interview really like. So I did my interviews not too long ago, and they were a daunting time, but it was a great experience, and I got to where I wanted to be. I am in medical school, 1 year away from graduating and being a doctor, which is almost, I think, all of you guys aim for your future. So I'm really looking forward to speaking to you about what medical school interviews are really like. So how do you think I felt? Like, I felt there was loads of emotions going on, but before and during my interview, these are some emotions that I was going through when I was a student. And this is back to when I was 17, 18 years of age, and you're having to go to an interview and present yourself, sell yourself, show your personality, and try and win that spot in that medical school. And spots for medical school is not easy to come by. There's normally about 3, 4, 5 people per applicant per spot for medical school's interviews. And so therefore, it's always so hard to deal with it. So some of the feelings that I was going through and emotions were I was nervous, scared, anxious. I was questioning myself as well. There's some questions that I felt like I was wondering, oh, am I good enough? Am I good enough for this spot? Am I good enough for this university? And these are all feelings, emotions, and questions that are absolutely normal when you apply for a medical school interview. I was fearful, will I answer the questions correctly? That's a big one because that's where they're going to find out whether you actually do get that spot and whether you do get into that medical school is how you answer some of the questions. What do they think of me? That's a normal question to ask yourself. And am I speaking too fast? So please do let me know if I am speaking too fast, Mark. But yeah, that's another thing. And I've always had to think about all these questions and emotions throughout going into medical school. And am I saying the right thing? But then after you've sat that interview, you've had that hour-long interview, 2 hours long interview, and now you come out of it. How do you feel afterwards? And I had the biggest sense of relief. I was like, yes, I completed that interview. I've done it. I've done one step, because to be honest, getting an interview for a medical school is the biggest hurdle. So then to complete an interview and to finish the interview is another massive hurdle. And that's a big accomplishment that you should remember and be happy about. I felt happy. I was still anxious because I still didn't know whether I did get that spot. Did I sell myself enough? These are all normal emotions to feel like when you're after a medical school interview. Have I done all I could do? I knew that I couldn't do any more. I've done it all. I had to leave it and move on and be able to continue with my studies, continue with my A-levels and my EPQ. And then now the wait, that's a big bit. Now you're waiting around, waiting for that result to come through. Oh, you've got that offer, you've got an acceptance, or you see that UCAS change on track. And all these things are absolutely normal feelings and emotions to feel before, during, as well as after your interview. And did I do well? And normally many medical school interviews will give you feedback afterwards. And that's what I loved after both my interviews, that I was able to get feedback and see, okay, like where did I actually do well? I got both offers. So where did I do well and where didn't I do not so well? So I could learn for future interviews that you will have as a medical student, as you become a doctor, when you become a consultant. You're always gonna have interviews, whether it's for a part-time job or if it's for a medical school application. So I'm going to talk a bit about the types of medical school interviews there is. So there is normally about 4 types of medical school interviews, and the 2 main ones are panel and MMI. And I'll talk a bit more about each of them separately afterwards. And there's also some stuff that some universities will describe as structured and semi-structured. So structured interviews are that they have a set list of questions that they will ask you, and they'll stick to those list of questions and will normally deviate from that. Semi-structured is that they do have a list of questions, but they can deviate from those set of questions to ask you further on questions from the questions they've asked you. Or they could read something and pick something up from your personal statement if they have that in front of you, or if you said something, they can pick up on something you've said and question you more about that. And that's where the difference between those type of interviews are. So panel interviews are normally an experience that you're sitting in front of a panel of interviewers, and these interviewers can be doctors, they can be other medical students, they could be course directors, they can be clinical staff, they could be anyone, they could be members of the public. And so you never know who you have in front of you, and that's a daunting thing. You walk into that room, you see how many people are sitting in front of you, and you're like, oh my gosh, so now I'm going to sell. You don't know who's going to be, you don't know what background they're going to be. And so that's one thing you have to always remember with panel interviews. You don't know who their background is. And when you're in a panel interview, that's the only people who are interviewing you. You're not moving to another room and having another set of interviewers. You're stuck with those, how many numbers you have in that interview. And normally in their panel interview, it can range from 1 to 2 to up to about 4 or 5 panel interviews. And that's even more scary when there's more panel interviewers in a room with you, just yourself and you're sat in front of them and they're all asking questions. But one thing to also remember is that sometimes in panel interviews, they try and pitch you off. So in one of my interviews, I remember one of the interviewers on my left-hand side of me who was trying to put me off by doing random things. And I was trying to not focus on him. And that's a hard bit of, they can do and stuff like that to test you, to see if you can focus on the question they're asking you and not be worried about other things that's going on, or if you can easily distract it and you can lose your thought process. So that's all these things, important things to remember in a panel interview. But exactly as I said, all those emotions previously are still going through you now, but it's just how you deal with them, how you overcome them, and you just look forward to that goal at the end of the interview. So another interview type that is more commonly used in the UK now is MMI interviews. And you normally have about 5 to 10 stations, depending on the medical school that you go to. And what you basically do is that you go between rooms, you have one interviewer or 2 max in each room or each station, and you sit there and they ask you a few questions based around that station. And before you go into that station, they'll normally tell you what that station is going to talk about. So they'll have a title for that station and give you some background. So you can think about what you're going to answer in that station before you go in. And they normally give you about 1 minute beforehand for you to prepare yourself, then go into a room and sell yourself. One amazing thing about MMI interviews are that you're seeing different people in each room. So if you've fallen back in one station, it doesn't mean that's going to continue the whole way through. You can try and sell yourself in remaining stations. And that's one great thing about MMI interviews. You're seeing a range of different interviewers who are all assessing you in different aspects. But only one problem is that you're having to be able to cope with, if you do badly in one station, or if you feel like you've done badly in one station, don't let that affect all your other stations, and remember to carry on. Don't let that hurdle or challenge stop you. Continue, persevere. You'll continue to do better in your remaining stations. One station doing badly shouldn't affect all your stations normally. And so I'll talk about my 2 interviews. So I'm lucky, I did both types of interviews. So I did a panel interview at Brighton and Sussex Medical School, and that's down in the south of the UK. They have now changed that recently to an MMI, but back then it was a panel interview. And then I did an MMI at Durham and Newcastle Medical School. So a bit about my panel interview. There was 3 interviewers in front of me, as I said about that person on the left-hand side trying to put me off. 2 of them were medical professional and 1 of them was a member of public. And the person who was in charge of that panel interview, the person in the centre, she had my personal statement in front of her. So she had annotated and analysed my personal statement. So when I walked in, sat down, shook everyone's hand, and I saw my personal statement in front of them, that scared me, because I was like, okay, I need to remember everything I put in my personal statement and be prepared for them to question it all. And they did. They asked all the little grits and bits inside out my personal statement and asked me to expand more about it, talk more about it, sell it to them. And so it was daunting, but because I wrote my personal statement, I knew my personal statement inside out. So it wasn't too bad. It was a normal experience for me, and I had a lovely time in that interview. And they asked typical medical school interview questions of why do you want to study medicine, what work experience you'd like. And they asked questions about your qualities that you have as a person, communication skills, about the university, and then random dilemma situations that they will also throw in. In Newcastle and Durham, they had an MMI, which is 7 stations. So you basically moved around in each room. You had 1 minute outside to read about what's going to happen inside that station, and then 5 minutes in the station. And then MMI kind of prepares you for when you're in a medical school, you do OSCEs, which is a clinical examination in which is kind of a similar structure, but you're doing clinical skills. So that's why many medical schools have started to adapt and start using this mini multiple interview technique. And stations can normally range from loads of different types, and it depends on your medical school as well. Some medical schools do role play as well. I've heard the Oxbridge has Oxbridge type questions as well that are thrown into MMI situations. So that's how your interviews are. So you've had an interview, you get this email, you're celebrating, you're like, yes, I got that one interview. This is actually the interview email that I got from Brighton and Sussex Medical School. And so you get that email, so what do you do next? So once I got that email, I needed to prepare for an interview. So how do you prepare for a medical school interview? So I practice. And I researched loads of medical school questions. Some are on a medical projects blog, and there's some also on other websites online. I then read a medical school interview question book, which had about over 150 questions. And then I wrote answers to these questions and then used those as starting points of how to answer these questions, no matter in whichever situation. I then needed to understand a bit about what the health situation is in the UK at that time. So I read through the BBC Health page, just a quick look through every night of just seeing what's topics, what's in the newspaper currently about health and the NHS. That definitely helped me prepare for my interviews. And then I made a document, which actually was a 16-page document in which I answered loads of different possible medical school interview questions, like written like a good response to them, annotated them, adapted them, made them myself, made them a personal experience for myself. So they were amazing. And then I practiced. So you have to practice, constantly practice on your own. If it's talking to yourself in a mirror or talking to yourself while laying in bed, that's what I used to do, or talking with friends or talking with family members. Amazing, just continue practice. If you're able to, extras, if you can get onto interview prep course, such as what medical projects do, MMI interview preps, so you can practice with other people and develop that format as well, which is amazing ways to prepare yourself for an interview. So now there's loads of different types of interview questions: communication, personal interest, background and motivation, empathy, university, about the university course, problem-solving questions. So I'm going to go through a few questions, examples of what a normal type of interview questions are for medical school, and see how I'll let you guys, I'll ask you guys some questions as well. So if you can always use the chat box and put your answers through, and I'll have a look into there as well. But it's normally an amazing experience and you always have a great time. So this first question, give an example when you have played an effective role as a team member. This is a question I actually got in both of my interviews, actually, a very similar type of worded question. I got about how was you an effective team player? And what I use to answer this type of question is a tool called STAR, which basically stands for situation, task, reaction, and then result and reflection. So what happened in that situation? What was I doing? So for me, I was talking about how I did the NCS, and I was talking about how I had to play a team member role in the NCS when we was doing our expedition. So that was an amazing task. And then I discussed more about what was going on. What did I resolve? What skills did I develop? Then reaction of it. And then I reflect on it. How are these skills that I learned in that situation that I'm going to use to take into medical school? And that's how you answer questions like this. and how to prepare for interview questions about work experience, your skills and quality, using that framework of STAR: situation, task, action, result, or reflection. So, and then this is another question I got. Do you have a personality that it takes to do medicine? So a question like this, if you have, do you have a personality that it takes to do medicine, you're going to have to understand what personality do you need to be a doctor. So these are a few of my examples. You have to be knowledgeable, competent, confident, a good communicator, a good team player, hardworking, enthusiastic, motivated, and disciplined. Does any of you guys have any other examples of what personality that you should have as a doctor?
Do you want them to type it into the chat box? I can read some of them out for you as well.
That would be
kind
great.
of putting them in there. So empathetic is a lot, resilient, caring, honest, risk-taking, compassionate. Yeah, lots of people putting that one in there. Committed, bubbly, chatty, trustworthy, leadership, patient, kind, calm, determined, flexible, resilient, conscientious. They're just coming in.
Loads. But these are all great personalities that you need to be when you be studying medicine. You don't have to always forget about you're going to be a doctor as well. So your medicine is a study, you're educating, you're learning. But then when you become a doctor, you're working as a doctor, you're teaching, you're working on a ward with loads of different people. There's so many different personalities, skills, and qualities that you must have to be able to become a doctor or study medicine. And then what you need to do with a question like this, you don't just list them all to your interviewer. You need to give your personal example. You need to sell yourself. Show them what makes you that best candidate, that best student that they want to take into their medical school. So you have to give a personal example, give them some background, give them a talk about your work experience of how you got into it and why you got into it, certain things and how you've developed these personalities. A great response to do. Another question is, what is your main weakness? So before I read out my example, does anyone have any list of what's their main weaknesses? What would they put in? If Mark doesn't mind reading them out again.
Yeah, I'm just going to read out 500. Public speaking, time management, perfectionist, overthinking, laziness, can be shy, stubborn, low confidence, perfectionist, distracted, shy. You start to get kind of like themes from this. So shy keeps coming up, perfectionist keeps coming up.
Really, loads of these are all correct main weaknesses that you could have. And a question like this, what the medical school interviewers do not want you to answer like this question is saying that you have no weaknesses, that you're all rounder, you're perfect. Everyone has a weakness and everyone has something in their personality or in their skills and qualities that they can develop and grow stronger about. So if I was going to answer this question, and how I did answer this question similarly, is I would have said, I'm someone who's ambitious and I like getting involved in numerous projects in order to achieve a lot and develop new skills. In the past, so I've given them past experiences about what has developed, that I've got this main weakness. I've gotten involved in many activities because I didn't want to disappoint anyone, which placed me in a difficult situation in which I had lots to do in a small time period, which sometimes was stressful. Occasionally, I'm getting better at distinguishing and realizing the amount of activities that I could get involved in. I've learned to manage people's expectations and be honest with the amount of workload. So how I've done this, answer this question, is I've said my weakness, given them some background of it and how I got to this weakness and how I'm learning about this weakness. And then at the end, I've realized that that now I feel much more confident in dealing with these requests in the future, and a skill that I would use while studying medicine and beyond. So that shows to the interviewer that I've reflected on this answer. I've thought about this. I've thought about how I'm going to use this weakness for a better of a university, better of a medical course, and better myself when I become a doctor. And these are stuff that interviewers are looking for. So another question is, why do you wish to study in a medical school? So all medical schools know that you've applied to like 3 other medical schools than their one. So you apply to 4 medical schools in the UK. So they know that you really want to get into that medical school or into medical school of some sort. But why do you want to get into that medical school? And you have to kind of sell yourself for what reasons do that medical school make you feel like you deserve that spot. And to follow a theme, you kind of have to talk about these 4 main informations about that medical school. Their core structure. What entails you to that medical school core structure? What do you like about that core structure? What about the teaching style? What is the teaching style like? How are you going to use that teaching style for yourself when you become a doctor? What hospitals, what's the type of demographics in that area? I was in Newcastle, so the demographics in Newcastle, there's loads of socio-economic disparities and inequalities in the Newcastle area. So I could talk about that. And then the location, the social aspects of medical school. So don't forget about the social aspects of medical schools, because universities always love to see that you want to get involved in societies, you're looking forward to being in a new city or town or village or area, that you're looking forward to getting involved. You're not just going to come to medical school, learn everything and then move away. They want to see that you're bringing something to it. So this is my response to a question like this. The core structure. And this is my response to applying for Newcastle. So the potential opportunity to integrate a degree with an MRes or a bachelor's in years 3 or 4, and the integrated structure of a course with the early ability to see patients in primary care settings and community clinics. This is what made that course appealing to me. That's how I answer core structure. The teaching style. The ability to undergo dissection sessions, which provide me with greater understanding of human anatomy. So I've researched about this university, and I know that they do dissection and they don't do prosection. So that shows that you know about the university, you're not just applying to the university, that you've understood the core structure and the teaching style of the university. Then about associated hospitals and population, with diversity and socio-economic backgrounds of a population in the community, will provide me with the ability to see a range of individuals. But access to a university to teaching hospitals around the area is very varied. So I'm in Newcastle, so I knew about Newcastle with a tertiary hospital in the city centre and how big that hospital was, and it had an associated children's hospital. That all these things are things that I said in my interview to prepare me and what medical school interview is really like. And then a bit about the location, that I'm looking forward to living on campus and being at a campus uni, or you could say you're living going to a city university and looking forward to being in a city from when you've not lived in a city before. Another important aspects. Or the social aspects. So being part of a medical society, MedSoc, being able to join other societies like sports societies like football are things I'm looking forward to. Being able to be in a brand new, beautiful, exciting city. Ways that you answer a question like this. So another question. So this is a very common question that medical school interviews are starting to ask, because they have definitely seen a lot of students not becoming doctors after they graduate. So they're trying to make sure to see how passionate and how willing students are to get into study medicine. So here, this question is, why do some students who qualify as doctors give up medicine and never practice? So you need to understand Revolver Doctor. And Revolver Doctor goes over 4 main roles: clinical, academic, management, and personal. So to answer a question like this, clinical aspects of it, that they may not qualify and become a doctor, is they find medicine too complex. There's too much learning to be done before you can have the responsibility that some endeavor for. So before you become a consultant. Once you graduate from medical school, it normally takes about 10 to 13 years, if not longer, to become a consultant. Some people don't like that long process. Academic aspects of it. Some don't enjoy doing the teaching aspects of being a doctor and having to teach medical students, and some get frustrated about this, and these are reasons why they may leave. They feel that it's too much time is spent in meeting and on paperwork, which they don't feel the expertise are always needed in. And personal reasons, long hours, unsociable hours, make it difficult for them to have a stable private life and a regular pattern, which is sometimes difficult for some people. These are all reasons why some students don't qualify and become a doctor and they never practice. And these are also reasons of why they want to see that you understood that these are some downfalls of studying medicine, and you're able to understand these downfalls and be able to prepare for yourself for what it will become when you become a doctor, once you're after studying medicine. And these are stuff they're looking for in the interview. But you need to always remember that you're a hard worker, you're highly ambitious, you're always determined, you're organized, you got to this far, you've applied for medical school, you've got an interview. Now, this last bit is to sell yourself and to get this interview and to become a doctor, which I think all of you guys here would want to be, as you've joined this webinar out of your own time. That shows your dedication, your passion. These are stuff that you can talk about in your interviews. So this is the very last question, and this is problem-solving, dilemma, situation type of question. And I got this in Brighton and Sussex in a panel interview, and they asked me, if you're a Prime Minister for one day and you've been allocated £1 million for NHS, where would you allocate it to? And this question threw me out of it because this wasn't a question I had prepared for before. So I was absolutely stunned. I was like, oh, I don't know how. And it's absolutely fine. They understand you've not prepared for a question like this. And it's always good to take your time to just prepare, sit there, think about it before you just rush into a question. So I thought about it. I remembered that I had read through the BBC Health page, so I knew what was going on in the NHS at this time. And at this time I was applying, it was more about the junior doctor contracts and the lack of pay for doctors. So I knew that, that I'd probably put some more money in towards that. Or I knew about other lack of funding in the NHS, such as cancer treatment, mental health services. And I was thinking about, maybe I'll put things like that. But what they're looking for you for this question is that you're able to give reasons and arguments for and against your decision. You're able to weigh it up. You don't go straight to one point and you've not thought about any other points that could be relevant. They want to see that you're able to plan an answer, plan a full process of this and how you thought about where you're going to give this money. There's no right or wrong answer with this question, but you just have to adapt to the situation. And that's what medical school interviews are like. You're always having to adapt to situations, adapt to interview questions. You'll never know what you're prepared for. But as long as you've practiced and prepared yourself for situations like that, you should be absolutely fine. So now, ask away. Ask me whatever questions you like. I'll hopefully be able to answer all of them. And I can see you've got over 100 questions here. So I'm going to have fun answering them. I just stop sharing my screen.
Yeah, so we'll use the Q&A function rather than the chat function, just because the Q&A function allows us to use the upvote system. So I'm just going to start at the top, and this is the first question that's there. It's got over 150 votes already. 160, it's going up and up. So what can you do in an interview to stand out from the rest when in an MMI and a panel interview?
I would say be yourself, show your personality. So I'm a bubbly person. I like to smile. So if you're smiling and showing you've got open body language, that's so much more nice and comforting for the interviewers to make you feel like, oh, okay, I could have it in a room. I'll be able to teach her, or I'll be able to take her to a ward if they're a doctor or something. So just showing them your personality, being able to sell yourself and show, oh, okay, that's what they're looking for in an interview. Some people are trying to overly be so strict and focus on an interview, and they always forget about being themselves. And that's what the interviewers are definitely looking for.
Yeah, I think when we're doing the kind of the mock MMIs, it's being a really good natural communicator and being able to almost have like a conversation rather than feeling like you're just kind of regurgitating answers. I think when we're on the other side, it's just nice to have a really good conversation with somebody and for them just to talk through the experience and then nicely link it back to being a medical student or being a doctor. That natural conversation is the thing that always stands out when I'm speaking to students. And I think that comes from preparation. Like you said, you know, the practice, you can get that down. You're just like, yeah, I've got an answer for this and I'll just have a chat with you about it. I think that's like the best way to stand out when me interviewing people anyway.
Yeah, definitely. Because I think what I was lucky about that before my interview, I had worked as a part-time. So I spoken to loads of people in the public. So I had that being able to speak to people I've never met before. And that's something you'll have to learn and be able to do. And that's what they're looking for, that you're able to speak to anyone. So you just learn that with practice, speak to people that you wouldn't normally speak to, say hello to on the street, start a conversation. That's how it starts.
So the next one down is probably this we could spend probably a whole hour trying to answer anyway, but we'll try and summarize and answer as briefly as possible. So how to answer the common question, why do you want to become a doctor and not a nurse? You could have an hour on this easily in a full webinar. It's a really difficult question.
It's a very difficult question, but they do throw it out because they know it's a difficult question. main tip that I'll give you for answering this question is never downplay the role of M&S. Always remember, like, they don't want to see that. They don't want you to say that, oh, doctors are better than nurses, or doctors do this over nurse. You need to understand that the nurses' role are changing so much currently in the NHS, that there's so many roles of a nurse now. They're not just the normal nursing roles that we always used to have before. There's now nurse consultants who are basically almost to the level of a junior doctor. So what I could say, don't ever put nurses down, and do your research about the different roles of nurses and the different aspects of nurses can do as well.
Yeah, I think again, when we talk about this question with students, it's always about understanding what a doctor does and what a nurse does. And you can only get that through research. And then it's just understanding that they are different roles. So maybe doctors spend more time problem solving or working out puzzles in terms of diagnoses, whereas a nurse might spend more time with the patients, and they might notice changes in the patient's observations more frequently. And it's just a very different job. But you can't put one above the other, because they have to work together. And I think that's the key. If you can talk about that, be like, doctors can't be doctors without nurses, and nurses can't be nurses without doctors. Like, they're so important to each other.
Yeah.
They just have different roles.
Yeah, for sure.
Cool. So I'm just going to go down to the, I know that's a massive question. We could spend ages on that, but we'll try not to. What kind of work experience looks good in an interview?
Work experience that is not the typical work experience. They know that medical students are not always able to get months in a hospital being able to follow a doctor, or being able to do work experience in a care home and being able to work there all the time. Some care homes don't always allow it. So doing work experience that's out of the ordinary is normally good, or things that you wouldn't think are work experience but are work experience. So if it's working in a group of students who are trying to do something such as like start a business or start a group of friends to do like a communication group, or if it's something like, oh, you're helping mentor your friend to get with schoolwork or peer mentoring, or if you're doing helping with a school football team, stuff like that are work experience. As even though they're not medical work experience, but they are still work experience. You're still working with people. You're learning empathetic skills. You're learning communication skills. You're learning how to be a team player. They're all still work experience. And I think with a pandemic coming, it's so much harder to be able to do work experience in hospitals. But you can still adapt to it. If it means you, doing one of the volunteering roles that are open in hospitals, or calling people with Age UK to help with loneliness or mental health issues, great work experience as well. And these are what stuff they're looking for. You've gone out and beyond your way to do stuff.
Yeah, we did a video we did a couple of webinars, and I think we did a YouTube video on finding work experience during lockdown. And I've just looked down the list, and there's loads more questions about that. So I'm going to put the YouTube link in the actual chat box for everybody.
Perfect.
And there's a couple of webinars on there, and there's at least one video about work experience during lockdown as well. So that's another good resource to go and check that out. But that talks about some of the things you just mentioned there as well, and a few more. So that'll be a good for everybody. Just looking down the questions again. So this is quite a good question. For ethical questions, is it okay not to have a specific answer?
That is fine. With ethical questions, don't forget the 4 pillars of medical ethics, as well as associated confidentiality, capacity, consent. Remember all those aspects of ethical questions and scenarios. Not having an answer is always fine, because normally when you're in a situation like that, you're always going to speak to other members of staff in that situation. It's a multidisciplinary team, always remember that. So even if you do answer a question and say, yes, okay, I think this is what I think should happen, just remember that, other people may not have that same opinion. And remembering ethical situations are dilemmas. So you're always arguing, there's no right or wrong answer on a question like that. Again,
I think we did another YouTube video just on medical ethics. So if there's anybody that wants information on the medical ethics, again, go to that YouTube. There'll be like a 10-15 minute video on there. Just looking down again. So when would you recommend that you start preparing for interviews? Like how long beforehand?
So for my interviews, I started preparing as I got it into like a off like an interview email. So it was about 4 weeks beforehand, and I thought that was more than enough time because don't forget you're also trying to revise for your A levels at the same time, and they're still very important because your condition of your offer is to get those grades. So you still need to complete that. So I did a bit of interview practice day to day. So like an hour, half an hour each day, and not so much because I didn't want to be overly prepared that I've rehearsed the answers so that I was just speaking off a script to them. But I did prepare myself. So yeah, don't be doing months and months of interview practice, but a good amount of time before the interview is always good.
Okay. The next kind of top question is, how do you tackle questions which are not medically related, such as how would you calculate how much coffee people drink in London? These are a little bit Oxbridge style, aren't they?
They are Oxbridge style questions. And with questions like this, they don't initially actually want you to have a correct answer. And they know that you wouldn't normally have a correct answer, but it's just your thought process of this. How are you thinking about to calculate these values? And that's what they're looking for, to see, okay, so how many people would have had coffee? Like how many people are in London, in a big city? You have to start thinking about these, calculating values from that. So yeah, it's going to be a difficult question, but as I said, there's no right or wrong answers, but they're just seeing your thought process of how to answer questions like that. And that's what many of the Oxbridge style questions are like. Seeing your problem solving skills, your analytical skills, your being able to adapt to new situations.
Yeah, it's not really about getting to the right answer. You know, they're not looking for, 2.3 million cups of coffee a day. They're not looking for something like that. They're just looking for you to be really logical and be like, okay, how would I go about answering this question? Well, what's the population of London? How many people drink coffee? Maybe it's 30%. So let's just work that out generally. And then how many people are commuting to London each day? So how many people are staying at home? And it's just working through that logic, rather than trying to get the correct answer, because you're not expected to know that. It's just the logic, isn't it?
Yeah, exactly.
So we'll probably have like another 5 minutes if that's okay with you. Have you got time for that? We'll just try and answer a few more. Okay, cool. I'm just trying to find one that we haven't kind of covered so far. So how do we answer the question, what would we do if we didn't get into medical school?
Show them how passionate you are. That's all I could say. I think show them that you're passionate to get into medical school, and that you thought about your other pathways of getting into medical school. So whether you're going to take a gap year and reapply, or if you're going to do biomedicine and then transfer into it as a transfer course, or you're going to do another degree and then go into graduate entry. Show them that you've planned an idea, a thought, but also show you're passionate. I think what they're trying to see is if you've actually really thought that medicine's correct for you and how quickly. So if you say, oh, you're going to apply for medicine, if you don't get into medicine, you're going to go and do banking, that can show to them, oh, you're really in it for the money instead of that you're in it for why many people want to study medicine, to help people or stuff like that. So that's what they're trying to look at, if possible.
Okay, cool. Obviously, a lot of interviews this year, or all interviews this year, are on kind of Zoom or Teams. Do you have any advice for people that are interviewing under those conditions rather than the normal conditions of turning up at the university?
I think it's harder being on Zoom because you're in a different room. You're not able to see their body language. You're not being able to show your body language as easily, but it's still be yourself and don't worry as much. I think you're on a screen, so you've got that barrier in front of you that kind of protects you, or that protecting feeling. But Zoom interviews are going to be difficult and different, but just adapt to it and try and sell yourself as much as possible on it.
Okay, cool. Currently, the top question here is, when should we start preparing for the UCAT /BMAT? It's not directly related, but we've had 116 people ask, so I want to just try and answer it if we can.
So for UCAT, I kind of practiced that question quite a bit. And for UCAT, so I practiced probably about 2 months worth, but it wasn't like in-depth practice. It was bits and bobs every day, just to I get prepared through my UCAT and paper. For BMAT, it was different because I decided to do the BMAT quite late. I think I decided to do it in October, just before the deadline when I applied for medical school. And then I think my paper went in November. So I only had about 4 weeks to prepare for the BMAT. So it was difficult, but I'm still being able to do it. And you still have to remember you're doing your A-levels alongside it. So don't worry about doing months and months, and don't try and start a year ahead, because it's not really going to help with practicing. But at least a month, 2 months and before is normally a good enough time. But it depends on who you are and your revision technique and how you answer questions, because everyone's different.
Okay, and given that all the interviews are online, is there like a particular dress code that you still recommend for when you're doing the medical school interviews?
Yes, still dress as formally as possible, because they are still assessing you in your environment, because especially in your home environment, you should be as comfortable as possible in your home environment or in your school environment, but still dress as formally. So still, guys, suits and ties, and females, formal dress, smart shirt if possible, a nice jumper, t-shirt, but as smartly dressed as possible, smart casual.
Yeah, and I think just kind of making sure that you've got, you know, a room that's prepared, you're well lit, the room's well lit.
Yeah.
And yeah, just making sure that everybody in the house knows that you're about to go on for an interview as well, and nobody's walking in. It's just that kind of level of professionalism, almost like this, where it's, you know, it's well lit, you're well lit, not crazy distracting backgrounds. I think just those little details are really important to mention, because this is brand new to a lot of people. So that's another bit of advice that I'd give around interviews as well.
Yeah.
Cool. So we're nearly coming up to 10 to 8. I'm just conscious of everybody's time this evening. Dedicating 50 minutes to a webinar is amazing commitment from everybody. So what's just kind of like your last final piece of advice, or the best piece of advice that you could probably like leave everybody with this evening?
Be yourself. I think that's the most important bit that I want to state. Be yourself. Know that everyone's in the same boat as you. And when you go into interview, everyone's scared. Everyone's trying to get that interview spot and that offer spot. So be prepared for a fight. Be prepared for an interview. Practice as much as possible. Be yourself and sell yourself. And that's the main thing I'll say and leave you with there. Hope that helps.
Yeah, thank you very much. Yeah, I'd just like to say thank you for taking the time this evening to come and talk to the students. I think your experience is absolutely amazing. You've had the MMI, you've had the panel, you've been the interviewer, you've had everything. So the students are so lucky to have you. And you can see all the thank yous rolling in the chat box already. So yeah, thank you very much. And if you'd love to come back for another webinar, we'd love to have you in the future. So thank you very much.
Thank you, everyone. It was nice to meet you all. It's been a great experience. Good luck for your interviews if you do have an interview, or if you're about to apply for medical school for this year. Good luck, and wishing you all the best.
All right. Thanks.
Thank you.
Right, guys. Thanks for kind of tuning in this evening. Layo was absolutely amazing. It's amazing having it on here. Thank you for tuning in. Thank you for asking really good questions. We'll send a copy of the slides out within a couple of days, and we'll put this recording on our YouTube channel as well. And there's another couple of webinars on the website. So if you want to go and pre-register for those, feel free to do that. Enjoy your evening, and if you've got any interviews coming up, very, very best of luck. We really hope that you absolutely smash them. All right. Thanks, guys.